This is Hayden Institute of Education. It's the Diploma of Mental Health. And this week and next week, we've got one module for 2 weeks, provide support to develop wellness plans and advanced directives. Over the last module, this module and the next module, which is CHCMHS012, it's all about quick interventions and quick one-on-informed trauma-informed care. This one on wellness plans, and the next one, I can't remember what it is, but it's 010 anyway, MHS010. And it's all about intervening in the best possible way. So to start off, we'll start with the acknowledgement of country. In the spirit of reconciliation, Hayden Institute of Education acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We recognise Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the land on which we work, live and study. We express our gratitude for the sharing of this land, our sorrow for the personal, spiritual and cultural costs of that sharing, and hope we may move forward together in harmony and in the spirit of healing. We pay our respect to all First Nation people and acknowledge elders past, present and emerging. Just to start off, this is the housekeeping, general expectations, your expectations of us and us of you. So we're a Cameron College. It just keeps everybody on the same level, just to see who everyone is. It just keeps everybody so that we can contact everybody. We know who's here. We know who's listening. We know who's participating. If we're going into a group, then we know that there's somebody on the other side of the other screen. Microphones off. It can affect the session negatively when noises come through on the microphone, like animals barking, shouting in the background, or children, or traffic, or anything going on. Comes through the mic very, very easily. So because of that, when we're interacting, participating in the class, there's a react icon underneath the video screen. So if you click on that, it puts the hand up there, and then we can have people interacting without everybody jumping on at the same time. With a few hours of study, then we will be breaking at 7 and 8 o'clock. It's very important to get some fresh air, water, snack, a few paces around the room, just to get everything relaxed again. So we'll do that. Respectful relationships, be mindful and kind with your words, and respect the opinion of others. We're all learners and in this together. It's very important that we're supporting each other. And equally, no smoking or vaping or alcohol on camera. It's a bit like a TAFE class or a work meeting. We don't, it wouldn't be allowed there, so we can't have it here. For the similar reason, there might be people that are struggling to give up something, and they come to a session and see somebody using something on camera that they're wanting to give up in real life. So we don't want it to be a trigger there. The triggers can be overwhelming enough. The class content can be overwhelming enough and triggering enough for some people. If that's the case, don't feel guilty about having a break and stepping away for a while. That's it's a very careful line that we've got to draw, that we've got to be addressing certain issues, but on the other hand, we don't want it to be confronting for anybody. We don't want it to ruin anybody's evening. And most of all, be kind to yourself. Yes, we're looking out for each other, but most of all, you've got to look out for yourself. You've got to make time to put back into yourself. With the amount of time that we might be putting into work or study or family, we've got to make sure that we're putting back into ourselves so that we are healthy and strong for the people that need us, and for ourselves most of all. So with that, we'll look at tonight. Oh, yeah, this. If there's any issues at all, please give us feedback. If I remember, I'll put this link into the chat box. We change the course regularly due to the government's feedback, but we also change the course due to learner feedback as well. But if no learners are giving us feedback, then we don't know how to change it for you guys so it's better. Obviously, you can give me a 5-star review if you want, but the main thing is that if enough people tell us how they want it to be navigated with the course, then we can obviously change it that way. We never used to do assessments in class. We used to leave that all to you guys, but because of learner feedback, we said, no, we can bring the assessments into the class and get them done here. A lot easier. So tonight we're looking at legal and ethical considerations mainly. Part of a new module. So it's legal and ethical considerations, especially in the mental health sector, mental health work. Now, a key part of that would be a wellness plan. This is a bit vague, so I've got some resources to look at in a second as well. So we're going to support people living with mental health issues to set goals for wellness, decide on strategies to help them achieve wellness and recovery goals, be aware of triggers, be aware of changes in their mental health, which may indicate that they're becoming unwell. When somebody is trying to access a service that we're working for, they're coming to us for goals. Somebody could genuinely come to a mental health service and not know what they want out of it. They just know that they want to get better or they want to be more healthy. Don't know how, they don't know in what way. Other people have told them they might need to. So they've got no real strategy to do that. They're coming to us for goals, they're coming to us for strategies. They're coming to us because they don't even realize what triggers they might have. And they might not realize what changes are happening in their own life and how that's going to affect them. That's a bit overwhelming for us because we might not be strategic thinkers or goal focused in our own life. But once we get access to certain tools, we can actually think in that way. Even if we're not naturally strategic or we're not naturally goal focused, we can look at certain resources and start to look at different goal sheets, different target strategic sheets for different clients. And eventually it happens, it comes, and we start to think that way. Even if it's somebody's going through things that we've never gone through, we can still learn what triggers they might have that we might never understand them, but we can know them, we can have knowledge of them, even though we might not experience any of them. And we can know in certain circumstances what changes somebody might have in their mental health that they might not be able to realize, and we might be able to expect them. And we can then talk to somebody about these changes. So, let's just bring something up. So smart recovery, for instance. Two main things, smart recovery and the First Access website. So I'll look at smart recovery first. If you're not sure what smart recovery is, this is the best way to describe it is it's a bit like AA or NA, but it's not. So it's a group where people with alcohol and drug issues or mental health issues can come, and it's not somewhere where you're going to be told how to change your life. It's a peer support type group where other people that are going through the same type of issues can offer not even advice. It's just, well, when I get anxious, I do this, and these are the things that really, really help me. So it's not a therapy group; it's a social group that helps peer support for people. So I was talking about goals and strategies. There's a resource there. A lot of them are worksheets. Some of them are just bits of wisdom and support. How to cope with urges. If we haven't had urges or triggers to do a certain thing, then we can look at these tools, worksheets, and try to strategize for that person. Disrupting unhelpful thinking. Unhelpful thinking can start taking us down a negative path. And once we start thinking a certain way, the behaviors and emotions will follow that. They always do. So if we can literally disrupt the unhelpful thinking, then we can change somebody's behavior and emotions. So there's plenty of tools here. And that's an example of one area on the Smart Recovery website. Also, there's the First Access website. First Access is the pretend community service agency that you all work for when you're studying at Hayden. It's not a real place. It's just information online. We all have the same login, and when you need it, we'll get you the password. So that's the login, Hayden Institute, but I can't remember what the password is now, and it's all blank. So you log in and looking for a case note template. If you're not quite sure how to do a case note template, then there's plenty there. So for tools and all the dependence, addiction, policy, and procedure, for all the things that you might need, I would go for First Access first of all, and then try maybe Smart Recovery and see what they've got. So that's because a wellness plan isn't something that we instinctively draw up, and because everybody's wellness is going to be slightly different focused, some people are going to be no AOD issues at all. There won't be any alcohol or drugs issues. It'll just be a mental health support type thing. Other people are completely the opposite. There won't be any mental health support needed, and it's just AOD issues. And then you've got people right in the middle that have got a mixture of both. So everybody's wellness plan could be completely different. They're all going to have different goals. They're all going to have different strategies. They're all going to have different triggers. They're all going to need to be aware of different changes. But it's remarkable how common all of these things are. Once you start to work with a few people and you see that, yeah, everybody is different, but it's amazing how many different things will work for the same type of people. So that's the wellness plan. And while I was there, I might as well mention all the other stuff that's there as well. So I've got a few new people. If you need anything, this is my calendar. Whoops. I'll put that in the chat. Just you're allowed to book in for like 2.5 hours a month or an hour every couple of weeks, or is it the other way around? Something like that. And just to get a staff member to give you advice on assessments or anything really. So there's obviously learning support, but that's my calendar if you need it. Discord used to be for, why isn't it? Oh. Discord used to be mainly for gamers, but it's a way to contact other people. And Hader has started to use it for contacting other learners, either in the same class or in other classes. And it's taken ages to log in. So you need your own account set up with your own email address. And then once you've got registered with that account, then you look for the invite on your learner portal, your invite to join the HADA Discord account. And it's not logging in. Great. It usually works. And you can ask other people questions. You can ask learning support. You can ask the staff on here questions about. There we go. Once you've got the invite, then you got to read through the rules of engagement, other terms and conditions, just usual things like respect and professionalism. Be aware of your language, respect to the people, academic integrity. It's not a place for sharing any of the answers of the questions and the assessments. It is a place that you can find out information and support. So once you've read through them, then you click on one of the OK things to say that you agree with the terms and conditions, and then it gives you access to all of the channels. You're doing mental health, but that doesn't mean you have to stay in this channel. You can go into any of the others and ask, because most people are doing a lot of the same modules. There's only maybe 6 or 7 modules different. So youth work will be doing 6 or 7 modules different. Community service, they'll be doing a different 6 or 7 modules. AOD, mental health. But most of the modules, everybody does. And also for role play resources, when you're doing role plays, we want you to have a great role play. We don't want to keep sending it back. You can have 3 tries before, if you want to just keep having a go and then eventually ask for support. But we want you to get them done as best you can. So there's plenty of videos here on how to do a good role play, how to do the best one that you can. Some of the role plays that are a little bit more complicated have like domestic family violence one, this group role play one. So they've got special resources to make sure that you pass as easily as possible. So it is a place where you can just watch as many videos that are going to help you as you can. We have no desire to keep sending them back and remarking and remarking. We want you to get the best one. And also, as I mentioned, this module, this unit, this is the government's website. So the government makes the modules. HADA doesn't make them up. We just make the learning material. But the government tells us what we all have to learn. Provide support to develop wellness plans and advanced directives. So this module is for describes the skills and knowledge required to support a person living with mental illness to develop recovery, wellness plans, and advanced directives. These plans outline the person's preferences and plans to maintain wellness and to direct actions and support strategies should they become unwell. So straight away, when we've got no idea where to start with somebody, what's the personal preference of the client that we're talking to? How do they plan to stay well? They might have recently gone through a diagnosis of mental health, or they might have been struggling with it for years. Either way, what is it that's been keeping them strong? What's the personal preferences of the way they like to run their life? This unit applies to work with people with mental illness in a range of community services work contexts. So it's for specifically interacting with somebody that is struggling with a mental health issue. The learner guide here, there's a learner guide for every module. And this is for this module, only 2 weeks, and then we'll go on to another module with another guide. But this is what we've got to get through. 2 weeks, and we'll go through that. Obviously, you've got assessments and you've got back study to do as well. But we'll have a look at the assessments later on. So we've got legal and ethical stuff there, providing support. So there's a bit of everything this week and a bit of everything next week. I'll just go through this legal and legislation stuff on the PowerPoint. So the purpose of a wellness plan, it's not to replace other treatments. So while we're doing a wellness plan with somebody, they can still be seeing the GP, they can still be taking the medication with the psychiatrist, they can still be going to the relationships counsellor, they can still be going to the AOD counsellor. So it doesn't replace somebody else. The more people that are working with somebody, the collaboration it's on nearly every assessment, but we're meant to be collaborating with other services to give the client the best possible outcome. So it's completely the opposite. They're only as effective as the information in them. So if the wellness plan has got very little information in there, it's not going to be that useful. I can. Sorry, just Alison asking for the learner guide. I can, but somebody told me that they're apparently very easy to find. I can definitely give you them, the learner guides, and I can put them in the chat and you can just download it there. But another student told me the other day that if you go in the resources in Accelerate, all of the learner guides are in there and you can search for them by the module code, which obviously I'll put the module code just in case you can get there easily. So you should be able to search for the learner guide by typing that module code in search. However, if it's still a bit new, then I'll upload it in a few minutes. So the wellness plans are only as effective as the information in them. Like when we go to a GP, he's looking at our treatment plan, or if we're in hospital and the doctor looks at the clipboard or the chart, then if there's nothing in there, it's not going to help any of the specialists. It's not going to help me because I don't even know what's going on with my own health. So we have to put as much information as we can in there. Yeah, thanks, Kiri. The wellness plan doesn't guarantee access to resource and interventions. It doesn't guarantee a lot of things. It doesn't mean somebody's going to get well, but it's just a plan. And a lot of on the training website that I've just looked at, the government website, it talks a lot about contingencies. Like we make a plan 1 week with somebody, we don't see them for 2 weeks, they come back, they've done nothing in the plan, and they are struggling with life, which means we're not going to judge them for not being able to do any of the plan. We're just going to work with a contingency plan. We're going to say, that's fine. Okay, well, let's alter the plan because what was put in place wasn't going to work for you at the moment. So let's change it slightly, make a contingency plan and find you a goal that is more easily accessible, maybe a strategic plan that isn't as complicated. So what we're not going to do is obviously judge somebody that they can't put into practice some help that they needed when they're coming to us for mental health support. Otherwise, they're not going to come for mental health support if all we do is judge them that they didn't do what we asked them to do last time. It doesn't mean that the person will no longer experience symptoms. So a wellness plan is not going to, it's not the cure-all. It's not the thing that suddenly brings recovery in. It can help them on the way to recovery, but it's not a magic pill that's going to stop all of the symptoms. So there's different types. People with lived experience of mental health issues could have one style of plan. Clients should have faith in a plan with proven outcomes. There's another cliche that we use in community services a lot, that's evidence-based, whether it's youth work, whether it's mental health, whether it's aged care, disability. We're all working with evidence-based programs programs that have done really well, like sociologists have studied them and they've got really, really good outcomes, and everybody that does them will get good feedback from them, which means whenever we suggest something to a client, whether it's a program to do, to complete, or it's maybe a therapy that we're suggesting, it's all got proven outcomes. And we're not going to suggest anything that, oh, this will be a good idea. No, nobody else has ever tried it, but it might work. We don't work like that. We work with proven outcomes, and we work with things that really do work, which means we can have faith in the things that we're going to suggest, and we can be confident in suggesting that to a client. It's not like when I used to sell TVs and computers and washing machines 20 years ago, and I had to pretend to be confident in this TV and say, yeah, it's a great TV. That's not what we're doing in community services. We're literally saying, no, this really does work. It's been raved about by so many people that have done it. So wellness plans reflect the needs of people living with mental health issues. So looking at legal and ethical considerations, when the client is disclosing information, we've got to make sure that it's all private and confidential. We're not going to repeat any information from a client to anybody unless certain things happen. And we say that at the beginning of every new client, and we'll keep mentioning it every time we speak to them. So this is everything you're telling me is confidential, obviously. So you can trust that. But obviously, if you mention that the client is at risk of harming themselves, we have to pass that on. We have to take that to somebody that is going to do something about it. If they're going to harm somebody else, then we are legally bound to pass that on and report that, because sometimes people will tell us things that, all right, so it's all confidential. Well, I'm really ready to end it all and end my life tonight. Thank you that it's confidential and you're not going to tell anybody. Well, no, I'm legally bound now. I have to pass that on. And sometimes it's the other way around, that thank you for being confidential. When I get home, I'm going to hurt somebody. And I'm glad you're not going to pass that on to anybody, but it's just because of the way I'm feeling today. Well, in that case, no, I have to pass that on. And then the other one is children as well. If there's any children at risk, even not from the client, that could be somebody that the client knows, it could be the client's partner, the client's parents. If there's a child involved that could be at risk of harm, then we've got to pass that on as well. So when a client discloses information which leads you to believe that a child may have been at risk of not just sexual abuse, but I think there's 7 types of abuse that the child protection talk about, and it's linked with different areas of wellness. Obviously, we've got sexual abuse mentioned, but then we've got physical, we've got emotional, spiritual, and then it moves on to neglect as well. So there's active abuse and there's neglective abuse when we withhold or when we act. A lot of different kinds of abuse, and equally there's active and withholding kinds of harm as well. So when we're working in legal and ethical considerations, we've got to be working with codes of practice. I've just got to stop for 2 seconds. So it guides workers in providing support by ensuring behaviour is legal and ethical. So every industry's got a code of practice, whether we're working in finance, whether we're working in construction. That industry will have a code of practice of how to work appropriately. And the government has told that industry the way that they need to carry out their business. And in that industry as a whole passes the legislation on and tells each service and agency to work this out in their own way. So you might go to you might go to one industry that is working with privacy and confidentiality, and that's the legal expectation. But some services might rely heavily on computers, and some might rely heavily on paperwork and hard copies. There's no right and wrong. It's just that in one agency, you might have to do everything on a computer. And then on another one, you might have to do everything on paper. In some, you've got to do everything on both. It takes time, but it's just the way that service or that industry, that service or organization wants to work. And obviously, if we're not going to follow the code of practice, then we're going to be probably end up in court for doing something wrong. So it's going to be relevant to the organisation or the community services sector. With legal and ethical considerations, we've got to look at dignity of risk. Dignity of risk is usually mentioned a lot with aged care, and the best example is when somebody in an aged care home doesn't want to take the medication that has been prescribed to them. Like they don't, because they're an adult, because they have their own autonomy, they are legally allowed to not take the medication that has been told that they need to take. If it's if we're moving into an area where a mental health client has been legally court mandated to take certain medication, that's obviously different. But on the whole, everybody's got a dignity of risk. If they're human, they've got their own autonomy, they can take or not take any recommendations that any worker has suggested to them, and they don't have to follow it. It's their own free choice. They're the master of their own life, so they can turn down any suggestions that have been made. And then, as I mentioned, some people might be mandated by court to take an injection of the medication. If they, even then, they still don't have to take it. The choice is take your medication or go to jail. You take your medication or end up in a mental health unit. They don't have to take the medication. There is another choice there. That's just the taking the medication will mean they're allowed to stay in community. So with dignity of risk, we have choices. We can still take risks. We're allowed to. We can make and experience mistakes. We can enjoy our own successes and freedom to make own decisions and take risks that are hobbies or recreational substance use. If somebody wants to take a drug that is not recommended, it is illegal. People are telling them they shouldn't. We're suggesting to them that it is going to negatively affect their health. But if they still keep taking it, then that's they're still free to come and see us. We've suggested that they don't take it, or we've suggested that they do take this medication, but they're still allowed to come and see us. And then there's toxic relationships. Some relationships are negatively affecting people, and we're suggesting kindly sometimes that a family member or a friend is not helping with their thought patterns and not helping with their lifestyle. It's going to be healthier for them if they reduce contact with that person. But when they keep seeing that person or they keep taking that drug, we're still going to be there for them because they need the support. So mandatory reporting is when we have to report legally, and if we don't, then we're going to end up in court. Groups of people compelled by law to report child abuse and neglect. So there's different jobs that, like if you're a tradie or you work in factory, work in warehouse, you're not legally obliged, you're not legally mandated to report any abuse. But if you're public sector worker, public services like first responder or doctors, nurses, um, teachers, community service workers, certain roles in community suddenly mean that you're now legally mandated to report any child abuse that you find out. Um, there's slightly different laws and slightly different lists depending on the state or territory that we're in. And you don't need to know all the different ones. All you need to know is the answers to these in your state or territory. Because there's a slightly different list if you go from New South Wales to Victoria or South Australia. There might be an extra profession that has to report. But all you need to know when the questions in the assessment, um, you just need to know all about your state or territory. And again, with codes of practice and workplace in the community services sector, we have to report. But how we do that, depending on the agency and the service we work for, it depends on who we're working with. So some services you might do all of the reporting yourself, and you might contact child protection or the police yourself. But in other services, you're going to have maybe a child protection officer in the service, and you pass all of the details to them. And it's all taken off your hands because they're so busy that they don't want all of the staff to get involved in this all the time. It's important to know what your service or agency does, because if you're expecting somebody else to do it and you have to do it, that's a big problem. But if you're expecting to do it and somebody else is going to do it, then that's great. You've got a winner there. So mandatory reporting, this is the vague list. Education workers, not necessarily teachers, but education workers, healthcare and welfare, children's services, residential services, law enforcement, public servant employed in a government agency, community corrections officers, social workers, ministers of religion. All of these people are mandated. So if they find out anything, they have to pass it on. But then, for instance, if in Queensland and Northern Territory, I think, both the same, they don't have a list, because if you're a member of Queensland community and you're a barista, you're a tradie, you work at Woolies, and you see any child abuse going on, you're legally mandated to report it just because because you're a good citizen of that state or territory. So it's important to know the difference. It's important to know what your state sorry expects. Child Protection Act says certain profession, but just a sec. Joanne's throwing something in the chat just for study. So with discrimination, obviously still legal and ethical areas of working. With discrimination, originally discriminate wasn't a bad word. To discriminate is just to take something from one area and put it somewhere else. When you're a kid and you're discriminating the peas out of the meat and the chips, and you discriminate and put the peas to the side, that's just discrimination. Or you're discriminating the chips and putting the chips to the side. So all we're doing is picking and choosing and separating. Discrimination is bad when we're doing it to people and we're isolating certain people and moving them out. Yes, Mike, go for it. You've got your hand up there.
Thanks, Drainer. It's just a question around accountability with the mandatory reporting. So if you've got a number of people, particularly in Victoria, professions that are responsible for reporting any likelihood of or suspicion of child abuse, what happens if there is a child that's found to be abused? Does anybody go back and check, for instance, a school and say, did you notice this? If you did, why didn't you report it? Or how could you not miss it, etc.,
Yeah, totally. Yes and no. On the whole, the person that the child that's at risk is probably going to be already known by police or known by children's services. So your mention of when you find out, you're probably going to be passing it on to somebody that's already exploring certain things, and they've already got a plan set up with the family, and all you're doing is passing on supporting knowledge that something is going on. Unfortunately, there is rare times where um, it's not known already. And yes, there has been a small number of cases where it's been reported, nobody's checked up, and the children have died. Unfortunately, it's in the news, comes up now and again. That's quite often due to certain services not working together and not passing information on. So the answer is yes and no. Like some things do fall through the cracks. Some cases do fall through the cracks and don't get followed up on. And that is why all the time government services are wanting to get more and more sharing information, collaboration, working together, sharing important information and making sure that nobody falls through the cracks. It's a bit of a yes and no answer, unfortunately. Yeah, definitely. Continual improvement. So with discrimination, we're all, whatever industry we're in, even if it's not community services, construction, finance, all bound by anti-discrimination laws. As you'll know, working in any other industry, it's not legally ethical anymore to have men and women doing the same job and paying them different amounts. If you're doing this job, then whether you're male, female, black, white, you should be getting the same amount. So to discriminate on off the top of my head, age, gender, sexuality, race, religion, culture, any of these issues, then it's court worthy. It's worth going to court with that. And disability, yeah, didn't mention disability, intersex. So literally anything, any reason to discriminate and say this person gets this and this person gets this, and that's just because you're young, or it might sound it might sound as if it's right way some people see it, or I know you're working in Bunnings, but you can't, you're older, you're beyond pensionable age, so now we pay you less than everybody else that works here. I know you're a little bit older, but you'll get a little bit less. Well, if you're doing the same job, no, it should be equal pay for equal people. Or, well, you're just young, you're underage, so we don't have to pay you as much because you're still learning. If it's the same job, then it's literally the same wage. Or for training, there's an assessment. One of the assessments for one of the modules talks about somebody that's still doing a diploma, and they're doing a diploma. Nobody else has a diploma, so this guy that's done a diploma doesn't need as much training in the workforce as everybody else. Well, no, that's discriminating because I think it's mentioned because he's younger and he's got a diploma. So straight away we've got to pick out, is there discrimination going on and why is it? And then we can start to make legal proceedings. So duty of care is partially seen as the opposite to dignity of risk. Duty of care quite often is the reason that a lot of people get into community work, they feel like they've got a duty of care to people, and they feel like they've always had this caring attitude to people. But it goes duty of care legally goes beyond that, and it's literally it's an industry expectation that we work with duty of care, and that we're always considering the client, we're always considering the patient, the person that we're working with, and we give them the best care that the reasonable service can give. Um, and that means that if most workers in our situation would do a certain thing, then that would be duty of care. If we think we should do this for this client, but most other staff members would say, no, you don't have to call the patient in the middle of the night just in case they're having a heart attack. We don't do that. That's beyond, um, it's not that it's going above and beyond and you're really, really caring. It's that you've crossed your own boundaries, and that's beyond duty of care. It's outside of it. So we've got to remember that duty of care is based on the worker's experience. How much experience have we got? What's the training that we've got? What's the qualifications that we've got? That means that we can give them a certain level of care. Also, the age and the capacity of the person, the worker, owes a duty of care too. Reasonableness is determined by considering what a group of ordinary people would see as reasonable in a given situation. The best example would be last year, if a 93-year-old woman with a Zimmer frame, a walker, and a knife, if most aged care workers would call the police at the middle of the night on the old lady with the walker and a knife, then that's duty of care. If most care workers would say there's no need to call the police for that, then that's going beyond duty of care, and it's not duty of care. If it's seen in court that a police officer should taser a 95, 93-year-old woman with a walker, then if most police officers would taser the person and not talk them around or do something else instead, then that, again, is a different argument of duty of care. So it's what most people in that service or in that industry would do with duty of care. And we see what happens because it goes to court and we find that somebody has carried out duty of care or somebody has been negligent with their duty of care to the person. Community service workers can be sued if they breach their duty of care. Informed consent is when we talk to a person, when we talk to a client and say, okay, this is what I want to do, and this is how we want to work. I'm thinking that from what you've told me, we'll be looking at goals, we'll be looking at strategies about the best thing to do for you. I'm going to be suggesting a few referrals. Until somebody gives us their written informed consent to the document that we say, okay, so after all that, I need you to sign this to understand what we're going to be doing. Until they've signed it, we can't do anything, literally. We're not legally allowed to work with the person. Even when they have signed it, then it can still go to court and say that, well, I didn't realize that I was going to be talking about these things, and I didn't like the questions I was being asked. That's partly down to us not informing the client that the things that we were going to be talking about. And then it will come back on us and it will be decided whether we informed the client properly. So it's good to have the sheet, the document, very, very clear in saying exactly what it is that we're going to be talking about and what we're going to be doing. So given all the information, the risks and the benefits of the proposed action, just like when we go to a specialist surgeon and they say, okay, so to do this, what we're going to need to do is this. You're going to need to go under anesthetic. These are the risks of the anesthetic. These are the options that we've got. You've got all the options in front of you. I think the best course of action is to do this, whether it's surgery or not. And then here's the document I need you to sign. And the most often, I heard the other day, most often the reason that community service workers are going to court is not the privacy and confidentiality. It's not the mandatory reporting. It's this. The informed consent has come back and somebody's saying that well, I didn't know we were going to be doing that. I didn't know I was going to be asked that. I didn't know you were going to be passing information on to that person, even though they've already agreed to it. So it's got to be a clear and understandable way. The decision can be made based on all available information. Obviously, if there's going to be issues, we've explained it perfectly, but then the person is too young to sign a legal document themselves. That's going to be an issue. So we need to speak to somebody that's their legal guardian. If somebody's suffering with dementia, they are not cognitively able to sign a legal document. Equally, we're going to need a family member to sign for them. If somebody's under the influence of heavy medication, like mental health medication, that they're not able to sign for themselves, then we're going to need to get somebody to sign for them, or we wait till the medication's worn off, or significant mental illness that's not under the medication, if they're cognitively impaired because the mental health issue is affecting them intensely, then we're going to have to wait till that wears off or they're medicated so that we can communicate with them. Or if they're intoxicated with some substance. So if they're not of sound mind, then we legally can't do anything. And all we can do is just talk about the weather and did they watch the footy the other night? When everything's calmed down, we could maybe reschedule another appointment and say, okay, so if you've had a few drinks, then I reckon this afternoon, if you come back at 2 or 3 o'clock, I reckon we could probably do it then. Or they've just come out of a mental health unit, they're still under the influence of the medication. Well, that's fair enough. We'll rebook another meeting for maybe tomorrow or the day after, and then we can actually get this all sorted out then. But we can't do a lot if it's going to compromise us because we're putting our jobs on the line legally. With privacy and confidentiality specifically, we are still bound by the Privacy Act. Like I said originally, we've got to be keeping all of the information that we've taken from the client. It's got to be private and confidential. And when we say private and confidential, there is that clause of unless somebody's going to be at risk of harm. But everything else, if nobody's at risk of harm, then we're not going to pass any information on. Every piece of information the client gives us will be kept secure. If it's hard copy, legally it has to be in a client folder, in a locked drawer, in a locked filing cabinet, in a locked room. Not everybody's got a key to that room, maybe only the admin department, and I can't go and access that just because I want to. It's all kept in there secure. If it's soft copy on computer, then it'll be on a client management system, a piece of software that's got millions of passwords for everybody that logs into it, and not everybody can see it. So if I've got a bunch of clients and John's got a bunch of clients and then Mike's got a bunch of clients and Kim's got a bunch of clients, I can't see any information about any of your clients and you can't see mine. And we can't see each other's clients, none of the information. Even a GP or a psychologist that logs in, they might be able to see bits of our information, but we won't be able to see the psychologist and the GP's information on the client. So it's all locked down like a secure database. And then that software will be on a laptop that's got a password as well that nobody else can get in. I can remember quite a few years ago, I probably said this last week, when I first got the job, I had a laptop and it was frustrating that just because I just because I got up to go for a drink of water, by the time I come back, I've got to log into my laptop again, and I was only away a minute. So I disable the password screen, and then I can leave it. Just I can go and get a drink of water, I can get a snack, and I can come back. I don't have to log in again. And you get in very lots of trouble for doing that because anybody can get onto your laptop and see client files very easily. So everything's got to be secure. Everything's got to be all of the data has got to be private and confidential. Passwords, documents marked confidential, and that's a code of conduct because that's passed on legally from the government. But codes of practice, it's the way in practice different services and agencies all do it slightly different. Because there's different client management systems. There's different software that one company will use this one, another company will use this one. Just like if you, with us, you're studying using Accelerate, other people will use Moodle, other people will use another piece of software again. So there's lots and lots of different software for this type of work. We have to know the work role boundaries and the things that we should and shouldn't do. Like in some agencies, you'll take your phone home with you, your mobile phone, your work mobile phone, you might take it home with you, but you're expected to turn it off when you finish work so that no clients can contact you at 7 o'clock at night and say that they really need help when you're in the middle of dinner and you're putting the kids to bed and somebody's calling you saying, I need your help. That's going beyond a work role boundary. Another company will be saying that you leave your laptop and your phone at work, and that's just what that agency does. So you need to know not just what the work codes of practice is, but what the work role boundaries are. Some people in some organizations are going to be on call. So they're going to take their working laptop home and they'll be on call through the night, but that's part of their job. They're getting paid for that. They're certainly not expecting everybody to be on call 24 hours a day. That's not what you would be paid for in that job. And then work health and safety is another legal expectation, a legal requirement in every industry. So no research. 3 minutes to break time. So when we've got children in the workplace, whether that's children are brought in to the workplace or we're talking about children in the workplace, that would mean that if there's any issues of neglect in the workplace, we're going to be mandated to report, obviously. If there's going to be children in the workplace, depending on, everybody will need to do a working with children's check, but it's called something slightly different in every state and territory. I think it's a blue card down in Victoria, something like that. So if there's going to be children there, a staff member needs to go through with the checks. That's not just a policy and procedure, that's part of the government legislation. But the policy and procedure will be how that is implemented in each different agency. And that's based on this piece of legislation. Professional boundaries, I've alluded to that a couple of times. Limiting the disclosure of personal information. This is your personal information. So quite often, you've got clients that will be saying, oh, how was your morning today? How are you feeling today? And it's not the clients come for support, the clients come for mental health, but it's not about us. It's not about somebody coming in and saying, how's your day? So we can be polite and say, yeah, it's been good. But my stresses aren't anything to do with the client. And I should not be bringing my stresses, my relationship issues, my stress coming to work, my car breaking down, my frustration with needing some food and it's break time. None of that has got anything to do with the client. So it doesn't come into what we're talking about with the client. Again, equally, we avoid connection on social media. And there's ways to lock down and put yourself really, really secure on social media so that you can't even be searched if somebody searches your name. Or some people will use a maiden name when they're married, or some people will use a mother's maiden name, or some people will remove the surname completely. Things like that, just to make sure that you can't be searched out on social media. It's at least it's inappropriate for clients to know all about our social life. At worst, it could get very, very dangerous. So we avoid connection with social media. Even on in real life, if we see clients in the street or at local local shopping centres, or we work in an area where we're going to be seeing clients, we need to be really, really careful, because it just takes somebody not thinking clearly, maybe a drink, maybe tiredness, or maybe frustration, and things can turn sour. So not sharing personal contact details. That's why a lot of agencies will give you a mobile phone for work and then let you keep your own mobile phone separate. It's why also certain agencies will do a work social media so that you can, if you're going to use social media, you're going to be using the works frontage. So we set clear boundaries, never accept gifts or money. If a client gives us certain things, quite often it's innocent and it's just somebody wanting to be supportive and kind to us. But sometimes, too often, it's taken as, well, I'll give you this for special treatment. I'll give you this. I brought you a sandwich last week. How come I couldn't contact you at 8 o'clock on a night? Like, it's only fair. If I'm helping you, you should help me. So we've got to set clear boundaries, and we don't accept gifts. We'll leave it there, and we'll come back at 10 past. So break time. Relax. Okay, I'm just before we go back onto the PowerPoints, the learner guide, as I said, you can access it from the resources. If you're not quite sure how to do that, I'm just going to put it into the chat now, just so that you can download it if you still haven't managed to find it. The learner guide, we're going to have a look at a few of the assessments. So just click on the link in the chat and it will let you download it straight from there. And that's why we have pets, because they shout at us. Okay, I'm just going to share the screen so we can have a look at the assessments. So there's 4 assessments. One of them's dropped off. So it says 1 of 4. So this quiz, written questions, this is 1 assessment. Then this is the 2nd assessment. And then this is 3rd assessment. And then there's a 4th, I think it's a reflection or something like that. But we're going to have a look at this one a lot tonight. I've got about 10 slides left to do on a little bit about child protection and codes of practice still. So if you want to stick around, after we've looked at the assessments, feel free. Well, I just want to look down to see if the questions are understandable. Can everybody get into it? Can everybody see it on Accelerate? Yeah. Was it blocked last week, Kim? Is it you guys that had it blocked or something and couldn't get into it? Um, yes, I thought it was blocked last week. But 3 assessments. So, Mike, does yours say 1 of 4 or 1 of 3? And are they the same as mine?
Yeah, sorry, I lost you there for a bit. Yeah, mine says 1 of 4, but there's only 3 there.
Okay, fair enough. Then, if you've only got 3, you've only got 3. Don't look for another one. It
Oh, that's
won't.
fine by me.
Joanne's missing number 3. This one will be number 3. The case study questions, the case study, and the role play. That's pretty standard. What have you got, Joanne?
Sorry, just one sec.
Yeah.
It's CHCMHS012. So when I look on the overview, it says T404, T104, and T204. But yeah, same as you, case study, written questions, and a placement project. It just
Okay.
says that number 3 is missing, which is weird.
Okay. Hopefully they're still the same assessments. So the questions. Describe the purpose of a wellness plan. Yeah. You'll get the recording of tonight, so you can go back over the recording. You can see the PowerPoint. You can click on the PowerPoint, and you can take quotes from the PowerPoint. You can use the learning guide to answer these. With these written questions, pretty much all of it can be answered from the learning guide. You don't really need to go around Googling and searching for answers, which means when you've got the learning guide, right, I'll make sure they're all the same, bro. When you've got the learning guide open, if you do Control F and bring up the search bar, so we're looking at question 1 was wellness plan. So if you type wellness plan, it's got 217 times it's mentioned. So when we go down, we can look for, we want some serious information about it. So it's going to be not in any of the headings here. Whether you work in mental health service or in another community services setting with people with mental illness, you may be asked to help the person to develop a wellness plan or an advanced care directive. In this chapter, we look at what wellness plans and advanced directives are. So keep going down. There we go. So we found wellness plan. A wellness plan is exactly what it sounds like, a plan for maintaining health or wellness. Pretty straightforward, really. So that's how you're working with the learning guide anyway. So question 2, describe the limitations of a wellness plan. 3, describe the purpose of an advanced directive. Describe the limitations of an advanced directive. Number 5, there are a number of different types and formats of wellness plans. Describe the advantage in selecting a plan which has been designed and developed by people who have lived experience of mental health issues. So the focus there, by people who've lived experience rather than professionals, mental health professionals that have studied for many, many years all about mental health, and they've got some really important things to say. Or by people who have lived experience and actually gone through the mental health conditions that we're talking about. Both sides are important, but obviously with one, you're going to get a certain style, and with another one, you're going to get a completely different style. Sorry, say that. What do you mean now? Sometimes the questions might be zoomed in like that, and you can't see all of that. Is that what you mean? That you have to click on that to see all the questions? And then when you click there, the questions have disappeared. I have to go to reduce the zoom like that. And then they appear. If that's not what you mean, we'll get back to it. So number 6, describe the purpose of a statement of capacity and what should be included in the statement. There are many services for people experiencing mental distress, unwellness, and crisis. List at least 5 services relevant to your working location. Explain how you would match the needs of a client with an appropriate service. Describe the role of describe the role of witnesses in the development of advanced directives. What criteria must a person fulfill to be suitable as a witness? There are times when a client may disclose something to you and you are required by law to not keep it confidential and to report it. Identify when you need to disclose such information using 2 examples. So it's pretty straightforward, these questions. We've covered most of this just tonight. Describe the role of codes of practice in providing support to people living with mental health issues, referencing the code of practice relevant to your sector or organisation. Describe dignity of risk and its importance in self-determination and empowerment for people living with mental health issues. Describe mandatory reporting as it applies to as it applies to health and well-being of children and young people. Although you may not be working directly with children and young people, there is the potential for you to become aware of potential child abuse or neglect in the course of your work. Mandatory reporting requirements vary by state and territory in Australia. Explain the mandatory reporting requirements relevant to your state or territory and work role by completing the following table. Number 14, working in community services role carries a number of legal and ethical obligations. Anti-discrimination, duty of care, human rights, children in the workplace. Yes, Therese.
That question before, where you had New South Wales, Victoria and all that, this one, 13, do we have to put all of them in for each state, or is it just the state that's relevant to us?
It's always been just your state or territory, but unless they've changed it, let's have a look. Hold on. I'll look at the answers. It's a lot easier.
Dwayne, you're welcome to still share your screen, eh?
Yeah, when I'm recording, I probably won't. What number question was that? 6? No.
13.
13, thanks.
I think.
Yes, it is. It's giving me the answers for the states and territories. It doesn't say you have to fill it all in. And that's being recorded. Although you may not be working directly with children and young people, there is the potential for you to become aware of potential child abuse or neglect in the course of your work. Mandatory reporting requirements vary by state and territory in Australia. Explain the mandatory requirements relevant to your state or territory and work by completing the following table. See, it doesn't say you have to fill all that in. It just says,
Your state.
yeah, relevant to your state. Yeah, that's can't be any clearer than that, really.
Yeah, but when you had everything there, that's why I was wondering, did we have to fill that whole thing in?
I
Or
know,
was it
yeah.
just
And
because there
the
are some
problem is
questions in there?
there is, and that's the point. There's going to be somebody that's going to look at it. I know there's going to be somebody that's going to mark it and say, "Well, you got to fill it all in," and just, but it says you don't have to, because that's the way it is. So 14, working in community services role carries a number of legal and ethical obligations. They're the things that we've gone over tonight. Listed at least 5 strategies which you could use to maintain professional boundaries with clients and members of the support network. There are specific legislative requirements for the development of advanced directives, summarise the requirements relevant to your state or territory, discuss the strategies that you would use to ensure that you comply with the legislation, explain what informed consent means in the context of developing wellness plans and advanced directives, how do you gain and document consent in the workplace, describe each of the following values and principles of the mental health sector and explain how you apply them to your work. Recovery. These are the cliches that we talk a lot about. When you start hearing them, they sound like cliches, that the words that don't often mean much to people, but they're actually the way we work. We haven't got others on there, like we've got recovery-oriented practice, we've got health promotion and prevention, we've got holistic approach, but we haven't got strength-based, we haven't got evidence-based, we haven't got person-centered, and these are all of the ones that you'll hear. And the last one, describe the codes of practice, policy frameworks, and practice standards which impact your work in the community services sector. What strategies do you or will you use to ensure that you are applying these frameworks and that you are staying up to date with any changes? So we've got 19 questions. So if I split everybody up and give everybody a few each, that's 12 people as usual. 12 people, that's 3 for each group. I'll do 3. I'll do groups of 3 or maybe 4. I'll sort them first. So I've only done 3 groups, and then I don't have to chase around after 4 groups. It's easier. So I've got group 1, Joanne, John, Juliet, and Therese. So we'll do 5 questions for each group. So Joanne, John, Juliet, and Therese. 1 to 5. That's it. And then group 2, Aileen, Brooke, Kim, Kiri. 6 to 10, is it? Yeah. There's going to be 1 spare. Okay. So we'll do Joanne, that first group, you can do 1 to 6. And then group 2 can do 7 to 12. So that's group 2, Aileen, Brooke, Kim, and Kiri. And then group 3, Caroline, Maggie, Mike, and Nan. you can do 13 to 18. If you want to do 19, you can. Where was that really big one? Just a sec. Yeah, this one. Group 3. Don't do all of them. Maybe just do 3 or 4, whatever time you've got to do. So do that one last and do as much as you can in the time you've got. Don't think there's any of the big, huge questions. Yeah. All right. So I'm going to open the rooms. You'll get something on the screen just to click on to take you to the room, and then you'll be out of this screen into another small room with just 4 people. We're going to go until we'll go for 15 minutes. That should do. So then we'll come back to this room after 15 minutes and we'll have everybody's wisdom on what answers they found. Have you still got your hand up, Therese? Were you going to ask something?
What, like, I know it's CHCMHS012.
That's correct.
But which one is it? Because there's 4 of them. So what one are we up to?
Sorry, say that again. What do you mean?
Because, hang on, I'll find it. First, second, third.
Right. It doesn't matter how far you got. All good. If you didn't finish it, no problem. We'll get all of your wisdom from however far you got. So group 1, it was all the J's and somebody else, wasn't it? Joanne?
All the J's and Therese, thank you.
Yeah, that's right. Yeah. Describe the purpose of a wellness plan.
Joanne, you read them out, and then I'll take over.
Okay, cool. I've got that it is a plan to set goals for wellness and to decide on strategies to achieve goals, and it does not replace other treatments. Yours was more eloquent, Therese.
Oh. No, not really. Keep going.
Okay. It's a plan for wellness. That's what I have under that one. I haven't fleshed it out properly yet, but those were the 3 main ideas of it. If I can find it again. There we go. Yes. Wellness. Okay, so the wellness doesn't necessarily mean that a person's mental illness is cured. It's got to do with the recovery, and the wellness plan is then to set goals and strategies to maintain wellness, and also what needs to happen if they become unwell.
That's correct.
All right.
Okay. Oh, and they're not legally enforceable. We had that too.
Yeah.
Cool. Number 2, describe the limitations of a wellness plan. I suppose one limitation is that it's not a legal document.
Yeah. So we have there that it doesn't replace other treatments. It's only as good as the information it contains. It doesn't necessarily guarantee access. This is external issues like transportation or whatever can affect, access to the service. And you have to be able to work in harmony with other organizations.
Okay.
And then also, sorry.
Carry on.
Also,
Joanne.
it limits what can be disclosed to, personal information. So, like Therese was explaining to me, you can't just call up another service and tell them, hey, I've got this person here, they've got these issues and you can help them. You can't actually share any of that information without consent.
Okay. Yeah, no, that sounds good. I've just realized I need to correct myself. When I said it's not a legal document, it's not legally binding, no. But when 6 months in the future or 3 years in the future, when you get a court subpoena that says they want all the documents for this client, then in that case, you are legally bound to that document. And what you put in that document, along with the case notes,
You're liable.
is, yeah, that's right. You're liable for that. So just with case notes, the same with case notes, with a wellness plan, be very specific, because if anybody can misunderstand or misinterpret a word, they will. So yeah, with a wellness plan, exactly the same. Number 3, describe the purpose of an advance directive.
Hang on, I'll grab that one. It's to allow an individual to make choices about their future healthcare and end-of-life care when they are unable to do themselves due to a loss of decision-making.
Yeah. Pretty straightforward. And so how would you, just as a description on the end of that, how would you enlarge on that at all?
Yeah, you can document on it. Like you can document your preferences of treatment. Like if you want an NFR, or I want to be resuscitated, you can put that in. But if including refusing, like you can refuse some sort of treatments, like if you don't want to go on oxygen, for example, but they want to put you on oxygen, you can refuse that.
Yeah.
If they want to put you on antibiotics, but you don't want antibiotics, you can refuse. So whatever treatment you decide that you want has to be written down on a document, and a legal document as such, saying that I am of sound mind and whatnot. These are my wishes if this is to occur. I do not want to be resuscitated. I want to be comfortable and I want to be pain-free.
It's everybody's dignity of risk again, isn't it? Really?
Yeah.
All right. Number 4. Limitations of an advice directive.
Limitations. I'm getting there. Did you guys have anything written down?
Just that it's not power of attorney. So it's documenting the wishes of the person, and it doesn't give someone the power to make decisions on behalf of them.
Yeah, it's an advanced directives which with the limitations in ensuring autonomy and guided end-of-life decisions.
Ooh, where did you get that? That's lovely.
Oh, I'm just picking this up from my nursing background. Sorry if it's all wrong.
Sounds good. Like Joanne said, it's lovely.
Sorry.
Say it again. What was that? Guided end of life?
Yeah, say it again then, Joanne. Therese, sorry.
I've just shut it down. Now I've got to bring it. So what was the purpose of? No. What was that question again?
Limitations of an advance directive.
The limitations is ensuring autonomy in medical decisions, have limitations, potential conflicts. These include potential conflicts with clinical error, clinical ethical dilemmas, and difficulties in interpreting the patient's wishes over time or in unforeseen circumstances. Additionally, advanced directives may not always be sufficient to address the practical challenges of advanced dementia or other complex situations.
Okay.
So in short, it may prescribe treatments or withhold care in the view of medical professions. It raises ethical dilemmas, especially regarding artificial stuff. Or it can arise when a directive is unclear or ambiguous, or when circumstances have changed significantly.
Okay. Number 5. A number of different types and formats of wellness plans describe the advantage in selecting a plan which has been designed and developed by people who've lived experience.
Well, the obvious one, I think we've been able to empathise.
Yeah, definitely.
And sort of, and with that, have an understanding.
Yeah. That's a good start, definitely. Let's go to number 6 before break. Describe the purpose of a statement of capacity.
So it outlines what you can offer and what you can provide your client, so that your client can decide whether they want to go with you or they want to go elsewhere.
Okay. What I can and can't do, I guess. The scope of my role. Really.
I can't tell him he has to come to me. He has the right to make his own decisions on what he wants to do or she wants to do. Like, I can't turn around and say, John, you've got to go to Dwayne. He's the best in this field. That's where you're going. I can't be bothered helping you. I can't do that. It's up to John to make the decision on whether he wants me, Dwayne, Joanne, or Juliet, or Aileen on that matter. So it's what the client wants, and it's what is best for them.
Yeah, and that comes in when we might have a female that wants a female worker. We might have a male that wants a male worker, a young person that doesn't want a young person, or a young person that wants a young person, an aged care person that wants an older bloke, not a female, and
female only, males only. I don't want. Now, don't take this wrong. As the client would say, I don't want the turban head. Excuse me if I've offended anyone, but that's not my.
No, that's.
I don't want him to bring in my medication.
Yeah.
So it's up to them.
It is true, because equally a Muslim female is not going to want a guy necessarily to, well, most of all, not a guy to be working with them, and vice versa. So there's a lot of very strict boundaries in the way we can and can't work like that. Finally, what should be included in the statement?
I didn't get that one. Did anyone else do it?
No.
All good. We'll leave it there for a break then. Let's have another break.
Okay.
Back onto it. Hi, Joanne. What were you going to say?
Hi. Sorry. Yes. On that statement, sorry, that last question, we didn't get to the statement of capacity.
Oh, yeah, 6. Statement of capacity, yeah.
I was just out of curiosity doing some research, and it's a document that underlines what an individual's functional limitations and capabilities can be. So a adult is assumed to have capacity unless proven otherwise. And it's going to describe the person's conditions that affect their everyday functioning, provide evidence for accessing services, funding or support, and help planners and assessors to determine appropriate supports. And then what it's got to...
Sorry, Joanne, it's like a return to work program where the doctor gives you a capacity of how long you can work for, sit, stand.
Okay, so it's not
like that.
Oh, okay.
Well, that's my understanding of it.
Dwayne, please look at the answers. I've confused myself.
So I'm thinking that it's going to be it's going to include in that the statement of cognitive capacity as well, isn't it?
Yeah.
And whether client is going to be able to consent to the procedure, the information.
That's what I was thinking earlier when we were looking at this question is, do they have diminished capacity in some way? You know, whether it's through drugs or their mental state, and thus not having the capacity to make decisions necessarily. That's what I sort of read it as. Not really.
Nearly there. It's number 6, isn't it? Oh, no, that's 8. Statement of capacity makes sure that the person's rights are upheld and that any actions taken on their behalf are ethically and legally justified. Autonomy, like Therese said, what should be included in the statement? Statement of the person's cognitive ability, specific areas of capacity, whether it's financial, healthcare, and choices, all about the professional undergoing taking control of the procedure, and any date, facts, date, time, specifics, location, and what the extended care, further care is going to be. Pretty much it.
So it's a document.
Yeah, just hi Maggie. Having trouble with my mic and finding CHCMHS012 in the home of resources. Can't find it for the life of me. If you could email me. Now, this is I can't see what people can see in Accelerate. Can anybody that knows Accelerate really, really well explain how to get into the module that we're looking at? All I know is that it's on the right hand side, but I can't, that doesn't really help anyone.
I'm happy to have a go at it. I'm not going to suggest at any stage I'm an expert, but
Thanks, Frank.
all right. So if we go back, now I'm going to try and do this in some sort of order. But when you go to the home page, if you start there, you see up the top left-hand corner, there's a square that says workshops with the number 20 next to it. What I've done is clicked on that, and then it comes up with a list of the relevant course workshops. And the one in which I click then is relevant to the date in which we currently are in. So 12 to 25th of June. I click on that. And then it has 1 unit of competency, and down the bottom, it's actually telling me that it's currently in progress. Now from that screen, there's 2 ways in which you can access the assessments. You can either click on that in progress square down the bottom, that gives the code for the actual course, or to the left-hand side there where you have a menu, there's a list. One of the list items says assessments, and there's the number 3 next to it. So if I click on that, then it brings up the 3 assessments. 1 of 4, 2 of 4, and in my case, 4 of 4. So the one in which we're doing at the moment is 1 of 4. If I click on that, it then opens another page where it says overview, task summary, and then down the bottom, because I've already opened it, it says resume attempt 1 of 3. If I click on that, up come the questions. How did that sound?
Sounds pretty straightforward, Mike.
Yeah.
It's just I always refer people to LSO because we can't see what Accelerate looks like, unfortunately. So I would say contact LSO if you didn't follow that through because they can see it. What were you going to say, Therese?
If you click on the homepage and go across to assessments, click on that. That'll take you to the all course assessments that it's got, and then you just scroll down until you find it. So
hopefully that helped, Maggie.
One thing I've noticed, Dwayne, is that there is more than one way to get it.
Yeah, there is.
And there's a number of different options. So
I thought you were going to say there's more than one way to skin a cat.
Well, there's that too, but you know, there's only so many cats.
That's right. Yeah. All right. Let's jump on to question 7. I'm not going to get the PowerPoint finished tonight. I don't reckon. I think I'll jump onto that next week. But number 7, we'll get all these answers sorted first.
That's me. I'm number 7.
Go for it, Kim. Yeah.
Relevant services. List 5. Do you want me to list them?
Yeah, please.
1300 MH call. It's a confidential mental health telephone triage service that connects callers to Queensland public mental health services. Lifeline. Beyond Blue. Acora's family mental health support. It's a South Brisbane-based service offering mental health care and support. Queensland Health Crisis Support Spaces. Provides urgent help in a calm therapeutic environment. And explain how you would match the needs of a client with an appropriate service. Just in dot form, I'll just say understanding the client's needs, using a structured framework, consider service availability, ensure cultural and personal fit, and providing clear guidance.
Cool. Number 8, pretty straightforward. Describe the role of witnesses in the development of advanced directives.
That's me too.
All right.
Confirm the person's capacity. Prevent coercion. Providing legal oversight and certifying authenticity.
Okay. And what criteria must a person fulfill to be a suitable witness?
Be a competent adult who understands the legal effects of the directive. Be independent. They cannot be a beneficiary of the person's will, the substitute decision maker, or paid personal carer. Be included in the list of authorised witnesses, like that includes health practitioners, JPs, legal practitioners, social workers, police officers, and teachers. Ensure the person is acting voluntarily without coercion or undue influence, and provide an advanced care directive information statement and confirm the person understands it.
Great. That must be none. There are times when a client may disclose something to you and you're required to, by law, to not keep it confidential and to report it. Identify when you need to disclose such information using 2 examples.
So that one was me. Oh, sorry, I hope that didn't go away. Sorry, my camera stuffs up sometimes. But I got when a child is suspected of child abuse or neglect, and if you are ordered by law to disclose such information.
Yeah, that's 2. I'm sure there'll be others, but it's only asking for 2, so that's good. Oh, I'm not even sharing. Hold on. 10. Describe the role of codes of practice in providing support to people living with mental health issues, referencing the role of practice relevant to your sector or organisation.
That was me as well. So I had Codes of practice guides ethical, legal, and professional responsibilities of those supporting individuals with mental health issues. They help ensure that care is provided in a respectful, safe, person-centered, and rights-focused manner. Within Australia's community service and mental health sector, the code of practice relevant is the National Practice Standards for Mental Health Workforce. These standards define the principles and expectations for best practice, including recovery-focused support, cultural competency, trauma-informed approach, and collaborative care planning.
Very comprehensive. 11, describe dignity of risk and its importance in self-determination and empowerment for people living with mental health issues. Who was that one?
Is Kiri around?
Kiri is, I think she might have gone for dinner.
Okay. I can able to help her
Okay.
then. Yeah. The dignity of risk principle is important for a person to exercise empowerment, especially for those people who are suffering from mental health, as this autonomy will increase their self-esteem and overall quality of life. In addition, allowing a person to take dignity of risk promotes self-efficacy and can help develop skills, confidence, and resilience, which is vital in the recovery process of an individual. Yeah. And healthcare professional, okay then, fine.
Okay. Describe mandatory reporting as it applies to the health and well-being of children and young people.
That one is mine.
Okay.
This includes the Child Protection Act of 1999.
Yeah.
Yeah, which the act,
yeah.
the Act of 1999 requires certain professionals who are known to be mandatory reporters to make report of a child's safety. If there is reasonably suspecting that there is a child that is in an acceptable risk of suffering significant harm due to physical or sexual abuse and being neglected, this is under the Child Protection Act of 1999. In this context also, a mandatory reporting law aims to ensure that the professionals who work with children are legally obligated to report to authorities. And its primary goal is to protect the children, the young people, from harm and ensure that they receive unnecessary support and intervention timely.
Right. And just bearing in mind that it's saying describe. It's not, if it wanted you to list what is the code of practice for what the people living with mental health issues, it would ask you to just state what the legislation is. But when it's saying describe, it's wanting sentences, a paragraph or two to say what it is and what it's for. So
is it worth
description?
Saying that if a child or a youth is at risk, that you mentioned a couple of states where it's mandatory for all people, regardless of your profession, to report.
Yes.
Is that what you're talking about?
Like, it is, yeah. Based on there's an act. Joanne mentioned an act earlier on, Section 316, concealing child abuse offence. So if it's not, there's a difference between hiding something and not disclosing something. So if we are aware of something that's going on, it would be wrong for us really not to report something. But it's arguable whether we're actually whether we're hiding it by not reporting it. That's the big thing.
Yeah, I thought the mandatory reporting was in regards to whether you're a worker in healthcare or
that's what it's meaning.
You know,
that's right.
If someone discloses to you information that puts young people or children at risk, then you're obligated to report it.
That's correct. Yeah.
Okay.
Number 13. So let's have just one state or territory. Anybody from this group. What is your state or territory, and what have you got for these answers?
Well, Dwayne, it's Mike.
Okay.
So
Victoria.
I had Victoria down, and I had the answers there, but because I went through how to get the assessments, I didn't save them. So everything I had written down is gone. So Caroline, are you there?
Yes, I'm there. Okay, let me just shut my door. I'm at work.
Oh, good.
Caroline came to our rescue, Dwayne.
Caroline does. She
Okay,
could take the class if
I'm
I wasn't
back.
here.
Yeah.
Okay. We are on number what? Okay, we are doing number 13, right?
Yeah. Which state or territory are you in, Caroline?
I'm in Queensland.
Okay.
Okay. In Queensland, of which I have all the territories, but I will just give you Queensland and Victoria, because that's the two that we did.
Yeah.
Okay. In Queensland, we is mandated to report. In Queensland, we have doctors, nurses, teachers, early childhood educators, police officers, child protection workers. What must be reported? Reasonable suspicion that a child has suffered or is at risk of significant harm due to abuse or neglect. Abuse and neglect types must be reported. We have physical abuse, sexual abuse, emotional abuse, exposure to domestic violence and neglect. Relevant legislation. We have Child Protection Act 1999, Queensland. Okay, in Victoria, it's a bit different with Queensland. So in Victoria, we is mandated to report. We have teachers, principal, doctors, nurse, police, midwifery, school counselors. What must be reported? Belief on reasonable grounds that a child is in need of protection from physical or sexual abuse. Abuse and neglect type that must be reported. At Victoria, we only have two, like physical abuse and sexual abuse. Relevant legislation, Children, Youth and Families Act 2005, Victoria. That's the two that we have. But if you need more, I can share more.
That's great, Caroline. Who's got number 14? Working in community services role carries a number of legal and ethical obligations. All the legal stuff that we've talked about quite a lot about, but it's just one in a different way.
Okay, for number 14, it's anti-discrimination. You are legally and ethically required to treat all individuals with fairness, respect, equality, regardless of their mental health status, ethnicity, gender, age, religious, disability, or sexual orientation, under laws such as Anti-Discrimination Act 1991, Queensland, and the Disability Discrimination Act 1992, you must not engage in or allow discrimination behavior, culturally inclusive and person-centered support must be provided at all times. So for duty of care Duty of care means you are legally obligated to ensure the safety and well-being of clients, colleagues, and other in your workplace. This includes identifying risks, responding appropriately to signs and distress or harm, and avoiding actions or omissions that could cause physical, emotional, and psychological harm. You must follow workplace policies and escalate consent when necessary. For human rights, as a community service worker, you must uphold the basic human rights of all individuals, such as the right to autonomy, privacy, dignity, and freedom from harm. These rights are protected under law such as the Human Rights Act 2019, Queensland, and the Universal Declaration of Human Rights. Clients must be empowered to participate in decisions about their care and be treated with respect and compassion. Children in the workplace, when children are present in the workplace, e.g., visit with their clients, you must follow child safety and duty of care protocols. This includes ensuring they are supervised, not exposed to risk, and protected from harm. You must also follow policies around mandatory reporting if a child is at risk of abuse and neglect. A safe and appropriate environment must be maintained at all times.
Great, Caroline. Who's got number 15? List 5 strategies that you could use to maintain professional boundaries with clients and members of their support network. Anybody?
Okay, Joanne. For
yeah, go for it.
Sorry.
Go for it. Yeah, just say, jump in.
Okay. Now, number 1, set clear communication limits. Use professional languages. Avoid sharing personal details, and ensure all communication is respectful and work-related. Follow your organization's code of conduct and policies. Adhere the guidelines on ethical practices, dual relationships, confidentiality, and social media boundaries. Maintain your role clarity. Clearly define your professional role and responsibilities to the client and their network to avoid unrealistic expectations. Keep records of all interactions, document meeting, support provided, and any consent to ensure transparency and professional accountability. Decline gifts and personal invitation. Politely refuse any gifts, favor, or invitation that may blur the lines between personal and professional relationships.
Cool, thanks. We'll get these 4 done, I reckon. Number 16, there are specific legislative requirements for the development of advanced directives. Going back to advanced directives, summarize the requirements relevant to your state, territory, and workplace.
Okay, in Queensland, the Advanced Health Directive is a legal document governed by the power of autonomy, Act 1998 Queensland. It allows individuals to outline their preference for future medical treatment, including mental health care, should they become unable to make decisions. It must be made by a person over 18 with the decision-making capacity, be in writing, signed by an eligible witness, e.g., a justice of the peace, commissioner of declaration, or a lawyer, and include a certificate from a doctor stating the person understands its nature and effects. Discuss the strategies that you would use to ensure that you comply with the legislation. Attend regular training on legal and ethical responsibilities. Includes updates on state laws related to advanced directive. Collaborate with medical professionals to ensure directive are understood and followed correctly. Keep your documentation and file all directively securely in line with workplace policies. Verify that clients have legal capacity when making the directive and seek a medical opinion if in doubt. Follow organizational policies and seek supervision if unclear about implementing a directive in practice.
Okay, so again, that we've got the word discuss there, so that means it's not wanting one point of view, it's wanting 2 or 3 points of view, it's wanting a few sides of a discussion. So it's not just a description, it's a few different sides of it. Thanks,
Yep.
Caroline.
Yep.
Are you is this you for the rest of this now, Caroline, or is
Yeah.
All right,
Okay.
explain what informed consent means.
Sorry. Informed consent. Informed consent refers to a process where the client voluntarily agreed to participate in a plan or decision after being fully informed in the context of wellness plan and advanced directive. It means the client must understand the nature, purpose, benefit, risk, and potential consequences of the plan or directive. They must also have the capacity to make the decision and be free from chaos and undue influence. How do you gain and document consent in the workplace? Consent is gained through open communication using clear and accessible language. The clients are given the opportunity to ask questions and are provided with all relevant information. Once the client agrees, consent is documented using workplace forms such as signed consent forms, progress notes, or entry in client's file. Verbal consent may also be noted in the records, specifying what was agreed to and the date.
Okay, I'm not going to do, this one was really big, so we won't look into that one. Did anybody get anything for 19? I know I didn't ask anybody to, but if there's anything there that anybody has, then that'll be great. No?
I think 19 is a bit shorter. I can just go through it.
Okay, yeah. Yeah.
Okay, so, on 19, describe the code of practices, policy framework, and practice standard which impact your work in the community service sector. The community service sector is guided by various code of practices and policies framework that promote ethical, safe, and personal-centered support. This includes the Australian Community Worker Code of Ethics, National Standards for Mental Health Services, and Human Services Quality Standards, CHCMHS in Queensland. These frameworks ensure that workers uphold principles such as dignity, respect, inclusion, confidentiality, and empowerment when working with clients, families, and community. What strategies do you or will you use to ensure that you are applying these frameworks and that you are staying up to date with any changes? To apply these frameworks and remain current, I will regularly attend professional development training, subscribe to updates from regulatory bodies, renew organizational policies and procedures, practice in teamwork and reflecting practice sessions, and consult with our supervisors and mentors when needed. Staying informed about legislative changes and ethical standards is essential for maintaining quality care. Thank you so much.
Fantastic. Right. So that is, so there's 3 assessments we mentioned earlier. That's one assessment. All of them questions is one assessment. We'll look at the other 2 assessments next week. One of them is the case study, and one of them is the role play, or the role plays, sorry. So we'll leave it for now. Is